like मैं आपके ऊपर मुँह दूंगा तो फिर means getting this kind of remarks and you can't react to that. This is, I think, for me though, it is a very much matter of pride that is getting hurt as a doctor. So where would a patient go? Would he come to you, or would he go to that center where top doctors are also sitting and he's going to get all investigations at a less cost? Today's video is on the pros and cons of every PG subject. Hello, I am Dr. Mayukh Harza. I am second year dermatology resident. I like to classify everything. So according to the demand of the branches, these could be classified into three broad headings. First is the evergreen branch. So what are evergreen branches? That is, it remains evergreen like an evergreen forest. So their demand is always high, but due to certain conditions their demand is slowly decreasing. Now these branches are high demand, they have a great high earning potential. These branches are associated with huge respect and popularity, but these branches are hectic. There are issues arising nowadays regarding the violence and the litigation issues, that is the legal cases against the doctors. That is why they are a bit less preferred nowadays, and more number of government jobs, and most of them have super specialties. Examples are medicine, surgery, OBGY, pediatrics, orthopedics, and anesthesia. Number B is the rising branches, and these are the top cut-off branches mostly. So their demand is slowly rising. They have a great work-life balance. They are mostly end branches, so they have early settlement, and everyone wants early settlement because मतलब इतने साल से गांड घिस घिस के सब लोग परेशान हो जाता है ना, तो दे वांट टू सेटल एट एन अर्ली एज and earn for their family. The number of government jobs are a bit less, be it government or in the private sector. You have to open your own chamber and become an entrepreneur. The name and fame is a bit less in these streams, and these are safer streams, safer from litigations and violence compared to the evergreen branches. The examples are derma, radio, nuclear medicine, physical medicine and rehab, psychiatry, respiratory medicine, geriatric medicine, to some extent eye and ENT also. And number C is the pre and paraclinical branches. They don't have the direct clinics, so they are a bit less preferred because they have less independent practice opportunities. They have low earning potential, but they provide a great work life balance and more or less litigation free. So the examples are pathology, MHA, ComMed, Micro, Pharma, Anat, Physio, Biochem. You all know these examples. Now, before going to the individual streams, if you haven't subscribed to my channel, do consider subscribing and share this video with your friends. So coming to the first branch, that is the nuclear medicine and radio diagnosis. The pros is that it has the greatest work-life balance, means the best work-life balance of all streams. They are initially high paying, they are very less toxic, and no incidents of violence. I haven't heard such incident of violence also. Litigations are there. Cons is the AI threat that has arisen. You have seen that Elon Musk had tweeted about his new Grooks, which can interpret the PET scan, MRI, CT scan. But especially the USGs would be done by the doctors only, by the sonologist only. And the AI threat that is arising, maybe it would take about more 20-30 years to indulge in India, and USG would be done by the radiologist only, and USG only gives the highest earning, not the MRI or the CT scan. Another cons is that sonologist course is of 6 months. So there are sonologists who are getting trained by 6 months only and they are practicing in periphery. And the worst part is that you only train them in your hospital, you have to train them. So this is the worst part, means you are training your enemy, you are training your competitor who is not eligible to practice actually. And there is a bit plateau in the income at about 7 lpm. More than that, if you want to earn, then you have to open your own center. And there is lack of recognition, I would say. Very less people know their radiologist, who is actually their radiologist. The average starting income, I have mentioned, this is highly variable. I have taken an average starting income of West Bengal only, where I am practicing. But radiology is more or less equal all throughout the India, except in the southern states where the payment is a bit less. So average starting income is about 3 to 5 lakhs per month. Coming to the next stream, that is dermatology, it has also a very good work life balance, so it is the second most preferred stream in the all India quota. Now it has the advantages of both medicine and surgery, and it is an N branch. The cons is that the quackery is increasing more and more, be it in the real field or be it in the social media. Everyone is a cosmetology specialist. So people go here and there. At first they go to the medical store, they apply something, then if it heals, then okay, and if it gets worse, then only they go to a quack. After that, if it gets further worse, then only they come to you. So that's why the patient pool is a bit less in the private chambers. And you may find it boring to see similar cases like 50% of the patients in my medical college hospital also are mostly infections only, mainly the tinea corporis. And there is less job opportunities, be it in the private setup or be it in the government setup. But the average starting income is more or less good, only 2 to 3 lpm. Coming to one of the most evergreen branches, that is the general medicine. The pros is that you have huge patient base in the peripheries, and they treat you like a god, so the respect is very much high. And this stream is taken solely by the passion to study medicine, so it satisfies your passion. Cons is that super specialization nowadays is a must, because in even tier 3 cities there are super specialists of every other stream. So super specialization is a must in this stream. There is high risk of violence. The maximum number of violence cases we hear occur in the emergency, and most government college emergencies are managed by the medicine doctors only. It is also a hectic stream. Average starting income you can expect from 2 to 4 lakhs per month. In case of PG counseling, if you are aiming especially for the deemed colleges, normal colleges, we get to know what are the fee structures and what is the salary. But for deemed colleges, it is very much difficult to get the information. And if you require guidance in that, then visit Collegestoria. Their website is collegestoria.co.in, and you can directly call into their number and book your consultation. So coming to the next stream, that is pediatrics. Pediatrics gives you a lot popularity, because a child is born and the whole family knows you. I have gone to this doctor after he had this problem, and people are very much serious about their child. Okay, if you treat them, they won't be that much happy, but if you can treat their child, they would be much more happier, because what the child is trying to tell by crying, no one can understand, and you have the special power to understand that and treat that cause also. And you can do super specialty in all the DMs. It is a very much hectic branch. It has about 110 hours duty during your residency. It is a declining branch because, as I have shared in one of my video, that after 2010, the pediatric population in India is slowly decreasing due to the reduced birth rate. Okay, so it is a bit of declining branch now. The violence incidents are also more, because if anything happens to one's child, then he becomes furious. The average starting income is more or less like the medicine, that is 2 to 4 lpm. Coming to the OBGY, It is one of the most preferred streams for the girls, and it has a very high earning potential, especially if you go into the reproductive healthcare system. Then it has more earning potential. The respect you get is very much high, and it has advantages of both medicine and both surgery. You can only practice medicine by doing gynecology, or you can focus on surgeries by doing operative gynecology and the OBGY part. The cons is it is very much toxic, hectic, violence is also occurs, and litigations also occurs. The average starting income is 2 to 3 LPM. Coming to general surgery, people treat you like God. It has high earning potential. Like in the villages, general surgeons are literally gods. It is very, very hectic. You know, the last year VMMC incident where for the first year PGTs were kept in the hospital for 5 long days, and they were allowed to leave for home only for 2 hours. After that also they got a lot of scolding, and those two PGTs left the stream only. So we hear incidents of being hectic and toxic, especially in the surgical streams like the general surgery and the orthopedics. As a matter of rule, medicine streams are more prone for violence, and the surgical streams are more prone for litigations. In general surgery, also, super specialty is a must, and the settlement is less. Like people go to you after you are 40 plus years. Okay. At least 10 years of experience you have, then only people choose to get operated by you. But after that, it has an high earning potential, but you have to bet on that. Surgery is like that of an artist. Okay. uh, like there are many artists without learning from anyone, they have drawn masterpieces like Van Gogh and Picasso. So surgery is like that. If you practice, you would be good at that, but you can't bet that you would be the greatest in that, which you can bet in medicine. So I feel surgery is a bit of betting. Okay. If you have passion, go for it. You can become the greatest surgeon. You can't bet on it. Okay. Which you can bet on medicine if you have knowledge and the communication skills. The average starting income is 2 to 3 LPM. Coming to orthopedics, it has a very, very high earning potential. It has an early settlement among the evergreen branches, but it is toxic, hectic. And the average starting income, if you go into the peripheries, it can go up to 6 LPM also. So it is about 3 to 6 LPM. Coming to anesthesia, many of you were asking that what are your views on anesthesia. So there is a good video on YouTube also available, I think, by Dr. Alok. So I also watched that video. It is an eye opener for anesthesia people. Pros is that you can do DM critical care. It has an early settlement. After doing the PG, there is a bit of work life balance. During PG, there is not much work life balance, but there is no recognition. Now you can ask me that in case of critical care there could be recognition, but the at the state when a patient goes, the patient is least likely to remember. Yes, the patient parties would remember, uh, but the rapport that establishes with the long term follow up, that doesn't happen actually, and it is a bit of hectic. The average starting income is 2 to 4 LPM. Coming to a new emerging stream, that is the emergency medicine. As it is new and emerging, so it has less saturation. You can do DM critical care. There is early settlement, but all the time you have an adrenaline rush, sleep deprivation. So you go into the end mode and you are likely to age faster, because a study shows that the American doctors involved in the emergency medicine age 6 times faster than common people, and the average starting income is 2 to 3 lakhs per month. Coming to psychiatry, it is rising because the mental health issues in Indians are also rising after the post COVID era, and the stigma is slowly reducing. And it also has the least AI threat because this is completely based on the human touch, human voice, the empathy. the whole stream is based on empathy, and it is very less likely that a person would feel empathetic when a robot is showing empathy, and he would be satisfied by that. Another pros is that you can do online consultation. Nothing you would miss while doing an online consultation, and while sitting in Kolkata you can do an online consultation of a patient in Mumbai, and you are going to get paid high for that. And it is also an end branch. It has also high earning potential, especially in the de-addiction sector, if you see, and the sexual sector, the sexual related diseases. Main cons, I feel, I also heard a recent incident which I am going to share, is that patient misbehavior. Like, think you are an associate professor. This only happened with our college department. Like, one associate professor, she was just joking with a child, 9-year-old child patient, that we are going to take you for admission. Okay, then he says that I still wet my bed. After knowing that also, yes, we would keep you in the admission only in a bed. Then he still says that then I would piss on you. Like, मैं आपके ऊपर मुंह दूंगा तो फिर, means getting this kind of remarks and you can't react to that. This is, I think, for me though, it is a very much matter of pride that is getting hurt as a doctor. So you have to tolerate all this. Another case happened that the patient was accusing, he was having some delusion of persecution, and he was accusing the doctors that you all are trying to kill, and he was going to hit the doctors only. So these things are very much common in psychiatry OPD, and these things, patient misbehavior is a factor that you should consider always. Violent emergency patients come, like after drinking, after drug addiction. It means the patient can do any kind of violence, and these emergencies you have to attend as a doctor. Average starting income is 2 lakhs per month, but I know some psychiatrists, they earn about 15 to 20 lakhs per month also, practicing in the peripheries only. After that is the physical medicine and rehabilitation. On this branch also many of you were asking, so I had got a perspective and I am answering on that. So it is an end branch. That is the pros. You can be a pain specialist, you can be sports medicine specialist, you can be a neuro rehabilitation specialist, and there is very less saturation at this point of time. But there is lack of recognition because people don't consider you to be a doctor. They think that you are a physiotherapist or something. And there is less number of government jobs because NMC has not made it mandatory as a department, because the number of doctors are also less. So the job opportunity in the government sector is a bit less. The average starting income is 1 to 2 lakhs per month. Now coming to I, the pros is it has a great work-life balance, it has good job opportunities, it has a less learning curve, and it is an in branch. Main disadvantage is that opening of eye specialist hospitals, that has means eaten up a whole lot of the jobs. You are going to practice in a center और उसके पास में ही एक आई सुपर स्पेशलाइजेशन हॉस्पिटल है जहाँ पे सारे तरह के टेस्ट हो जाएंगे. So where would a patient go? Would he come to you, or would he go to that center where top doctors are also sitting and he's going to get all investigations at a less cost? So obviously he would go there. So this is cutting a lot of job. And in the private sector, if you are working in the corporate, you know that only the top 5% earn, and they only do all 80% of the surgeries, because everyone wants to get treated by the best surgeon. So you have to develop that kind of skill so that you are in the top 5%, or else it is a loss for you. The average starting income is 1.5 to 2 lakhs per month. Coming to ENT, it has a great work-life balance. Now the cosmetology aspect, that is in dermatology and plastic surgery, some of it has gone into ENT also, because they are doing the rhinoplasty, the maxillary fixation and all, which is enhancing the beauty of the patients. So this has a high earning potential, but anything related to cosmetology also has chances of litigations if the patient is not satisfied by your treatment. So litigations is a risk, and the OTs are also risky because a slight here and there and the facial nerve gets damaged. So that is the only risk I could see. The average starting income is 2 to 3 lakhs per month. Another new branch is that palliative medicine. So palliative medicine pros is that it has early settlement, less saturation, and job opportunities now in the metro cities. Okay, so main cons is it is also a dependent branch, means a doctor would refer, then only a patient might end onto you, and the prospect in India at present is not that much great. Like the palliative medicine could also be given by the radiation oncology also, or maybe the medical oncology. Another stream that I have missed is the radiation oncology. It is a rising branch, so it is pros, it has a great work life balance, more or less an end stream. And the best thing is that you can do DM in medical oncology, and oncology is very much rising. The cases of cancers in India are rising exponentially. So if you do a DM in medical oncology, then you are going to earn a lot money also, and respect also. The disadvantage is that a bit of saturation in the centers. So maybe job prospect may be a bit less, the recognition may be a bit less. But as I said, that if you go for medical oncology, then it is the best option for you. A disclaimer is that this video is very much superficial video. It is not possible to cover all streams in just 25 minutes. So don't take your decision regarding branch selection with this video. Go with what your heart feels. I have just given this video so that you get to know a gist of all the branches. Okay, so if any MBBS student is watching, he would get a gist of all the things, and he could keep in mind that on what aspect I can go, or I can dream of my future branch to be. And if anyone before choice filling is seeing this video, then he would get a holistic approach. But if you have any confusion in branch selection, then here is a video regarding branch selection PG guide. You can go and consult that video. Okay, so all the best. May you get all the happiness.